a very good afternoon. This is Dr. Angelina Dias trying to have a chat with Dr. Alamkar Ramteke, joint replacement surgeon, and also a founder of Orange City Arthritis Foundation. So, can you tell me more about something about osteoarthritis and what is your take on that?
So, osteoarthritis is actually not a disease, it is like a physiological condition. All of us will grow old, all of us will get glasses or gray hair. Similarly, all of us will have degeneration in our knees. Degeneration means wear and tear of our knees, which is common with age. So, if you see between the ages of 60 to 65, 50 people out of 100 will have some form of knee arthritis or other. By this, I don't mean that all of them need knee replacement surgery, but then most of them will have some form of knee arthritis or other. And few of these people, they have so much trouble that they have to go to a doctor. So, osteoarthritis is not a disease, it is almost a physiological condition. All of us will get it
Yes,
in some extent or other.
So now, like we just had Janmashtami, which means Lord Krishna had 108 names. I also see arthritis is more than 100 types.
Yes.
So it's not always that we always think arthritis is a disease of the aged, but there is other kind of arthritis like inflammatory arthritis, various type of inflammatory arthritis,
Yes.
which affects the young, the children, the juveniles. So people suffering with rheumatoid arthritis actually think that I have pain and stiffness and we should not exercise.
Yes.
So what is your advice on that?
I think this is an excellent question on World Physiotherapy Day. So, people have been told if you have arthritis, don't walk. If you have rheumatoid arthritis, you don't walk. I think this is the biggest myth which is prevalent among our population. On the contrary, I tell all my patients that walking is the best exercise that you can do for yourself. It is so easy, you can do it anywhere. It doesn't involve any cost, it does not involve a lot of effort. It is so easy. So if you want to do something good for your health, start walking, and walking is the best form of exercise for anybody who is suffering from any form of arthritis. Walking is good.
As a physiotherapist, I would also like to add, so if even if you're in pain and stiffness, a physiotherapist knows how to pace your activities and what type of exercise can be done. Many times people ask me also whether I have to do hot fermentation or cold. So there are combination, there is contrast. We can advise you at which stage of your arthritis, what type of heat or cold will help you. And so I see that many a times people say I have arthritis or any type of arthritis, and they become very dependent. And
Yes.
even young people, young men and
Yes.
women,
Yes.
stop going to work giving
Yes.
arthritis as a reason.
Yes.
And I, being a proud Indian, and always my vision is to make Indian people productive, not dependent. So if we are productive, our country's GDP also grows. So there is a lot of fear among people that even though I see people their joint are going into deformity, and there is pain, there is swelling, but still go under the knife. But still there is a limitation of every sort of profession. I can help the patient as far as the deformity has not developed, there is no constant pain. But I would like to know from you, what would you advise to such patients?
Like we discussed at the beginning of our discussion, all of us will get arthritis, but not all of us will need knee replacement surgery. So all the patients who have arthritis, they don't need to undergo go under the knife and have surgery. Many of these patients can do with simple activities of daily living, like just walking, and most important thing is muscle strengthening exercises. Here comes the role of a good physiotherapist. If you can teach our patients how to do muscle strengthening exercises, how to do range of motion exercises, and help them with their lifestyle modification, just with good physiotherapy, many of these patients will be good for life. They don't need to undergo surgery. And I think physiotherapy role is not given its due credit. I think we should popularize and give its due credit to the great help that physical therapy can do to all our patients of arthritis.
Thank you so much, sir. One last question, I won't bother you much. Are there any screening tests that people with these inflammatory arthritis need to undergo as a routine so that they don't go into progression of the disease?
Okay, so we will talk for this question in two parts. One is osteoarthritis. So if you are elderly and if you have knee joint pain, don't neglect it. Go to a doctor. Just by going to a doctor, you will not be forced to undergo any surgery. Many times your doctor will be able to treat you only with lifestyle modifications, daily walking, physical exercises, physiotherapy, medicines, and sometimes some injections. You may not need to undergo surgery at all. So all these osteoarthritis patients, they should be, if they have knee pain, just go to a doctor, get properly examined, get properly diagnosed, get investigations, get MRIs. And if you are not bone on bone, you are doing well, maybe by losing some weight, doing physiotherapy, taking some medicines, you may not need surgery for your life. Then we come to second part. These people are people of inflammatory arthritis or a disease group called as rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, all these people. If you are a young lady and if you have swelling in your small joints of hands and feet, and this pain lasts more than 45 days and you have morning stiffness or symptoms like that, please don't neglect it. I would request all mothers, sisters, all young ladies and their family members, men who live with them, brothers, husbands, fathers and sons, that if your mother, sister or the lady member of your family, if she is suffering from joint pain at a young age and if she is suffering from pain in small joints of hands and feet, so this is a screening thing that you just spoke about. Just go to a doctor, get your investigations done. If treated early, all forms of arthritis, especially rheumatoid arthritis, can be treated very well only with medicines and they can lead a normal life. If you have rheumatoid arthritis and if you go to a doctor, get screened like Dr. Angelina said, if you get treated, get investigated, get diagnosed and get treated properly, all you need is one or two medicines for your life and you are good. You don't need anything. Maybe you will need some physical therapy once a while, but many times you can avoid surgery for life. You can lead a normal life too.
That's very, very informative and a good news to a lot of them, sir. Since you mentioned about mothers and the men in our families, I've seen even the children come up with arthritis, a condition called juvenile idiopathic arthritis. I think we should also not neglect children with joint pains, complaining or fatigue. So I think even the children should be spoken about it to inform the parents that if they are suffering from constant pain, and parents should not ignore that there is a child is all the time complaining about joint pains. They should be immediately taken to the doctors or orthopedics and just talk to them. So now one last question.
Yes.
As a physiotherapist, I always face, it's very challenging for me when the patients come with a prescription and says, I have to do 10 days physiotherapy. And physiotherapy is a lifestyle. We make a lifestyle modification, treatment. It's an ongoing thing. So it's not a drug or a course which is like thrice a day, morning, evening, afternoon, do exercise 10 days and you'll be done. So it becomes very, very difficult for our fraternity to explain to the patient that it is something which can maintain and promote health, not within 10 days of span of time, where they have had this problem for years together, more than 10 years, and it becomes difficult for us to just teach exercise because rehabilitation is a slow process. So I just wanted you to just give few words on this, sir.
So I think physiotherapy is a great tool of science. It is a great treatment modality of science. And I am just a surgeon. I am not an expert of physiotherapy. So in my practice, I leave all physical rehabilitation to experts of my team, the physiotherapists. And then I let my physiotherapy team and good doctors like you decide how much time the patient needs and what modalities are needed. I would leave it to the expert. So I would not tell my patients that, okay, you will be already in 10 days. I think it is patient based. For example, what kind of deformity or stiffness the patient has, how much pain he has, how much muscle wasting he or she has. And it is best left to the expert. So if the physiotherapist feels that this patient needs a longer rehab or longer treatment, I think it is best left to the discretion of the expert in this field, which is the physiotherapist.
Thank you so much, sir. This will give a relief to I think physiotherapists all over the world, not only in our country, all over the world. Thank you so much, sir. Thank you for giving your precious time to us.
Thank you for having me with you on this small video, and my best wishes to all my physiotherapy colleagues.
Yes.
Thank